2 minutes for questions?
Yeah, go right ahead.
Okay.
I have a question.
Well, we've got a microphone up here. And just one comment about what he said. Times of great stress are times when cracks open up in society, times when opportunities present themselves, and budgetary considerations on the municipal, state, and federal level. You've heard nothing yet about how crappy it's going to be.
I got to catch a plane. Sorry.
Anyway,
I had a question for Craig. How large was the sample of the study that was done in Amsterdam and San Francisco? How many people did you ask those questions of? The San Francisco-Amsterdam study, how many people were involved in it?
There were 2 levels of sample. We did random representative sampling of the households in both cities, and there was a larger basic prevalence survey done of hundreds in each city. And a sample of seasoned users was 265 in San Francisco and 216 in Amsterdam.
George had mentioned revisiting of the Schaefer Commission and forming a new report along those lines. I'm just wondering if you guys would comment on that. I know Mike Gray has been very outspoken. It was time for another one of those. I wonder if you thought it would be worthwhile and have a good impact.
Very quickly, the last one, Nixon was asked before the report, as Mitch, as you well know, was asked what he would do if this Republican-stacked, very conservative commission came out and said we need to decriminalize marijuana. And he said, well, then I'd ignore it. And he promptly did that, as politicians have done with virtually every other study or commission report that has come out with that kind of conclusion, as they all have. So on one hand, we'd be naive to think that this is going to change the world. On the other hand, the Schaefer Commission is still cited. It's still a good source. It's still one of the rocks that we throw at the glass house of prohibition. And so I think that creating the occasion of something like a national commission where this stuff would get discussed again, where the evidence would get reviewed again, would be a terrific thing and a terrific first step for, say, a President Obama we should be so lucky to make.
Another thing about updating the Schaefer Commission, since 1972 when the Schaefer Commission came out, we've got 30 years of evidence in Holland that we can look at. We've got more than a dozen years of evidence in more than a dozen states of medical marijuana use. We've got an incredible fund of research, medical and otherwise, that didn't exist then. And of course, we've just arrested our 20 millionth American. Isn't it time to reassess policy?
You know, I just want to add, there's another point here. A couple of weeks ago, I was in an all-day seminar in the House of Lords in London, this Global Cannabis Commission report that a few of you may have read about. And it had some surprising people signed on to it. And you know, part of the argument for making this marijuana legal is that it's relatively speaking, as Judge Young once said, the safest psychoactive substance known in human history. But you know the other reason for making it legal? It's that marijuana's got serious risks. It can be a problematic drug. And that this drug has too many risks, etc., to leave it in the underground, to keep it illegal. So you actually have some serious people signing on to the argument for marijuana regulation, legal regulation, saying that, you know, marijuana is becoming dramatically more potent, some say, not to the extent of Lee Brown, but potency has gone up, in part because of the criminalization, in part because of the illegality. There are issues around the health of marijuana. We do know that people can become dependent in problematic ways on marijuana. So it's the argument for bringing it above ground so we can deal with the harmful consequences more effectively. And I also think, you know, this whole thing, so much of the fight around marijuana now is around the imagery of the joint. And the more that we can move towards forms of consumption that, I mean, the more that you see the volcanoes and the vaporizers become more smaller, effective, the more we can remove that imagery and some of the smell that some people find offensive, I think the more that we gain. Because in a world in which the number one thing keeping marijuana use down, for better or for worse, and maybe the number one thing keeping marijuana reform from progressing further is the broader anti-smoking campaign, directed primarily at cigarettes, not at marijuana. But that's keeping it. Now, we can disconnect from that smoking, that burnt particle matter and that rolled paper, to something that looks and has a different feel and less smell to it, I actually think we make some serious room there. It just made me think, because we're talking about the Schaefer Commission, when I'm thinking about the Schaefer Commission, you know, just think about the fact that that commission, if it comes out the right way, it's not just going to be about marijuana being the least dangerous psychoactive substance. It's going to be about other things as well.
Okay, we've got time for one more question.
Thank you. My name is Dr. Steve Fry, and I just returned from 10 days in Washington, D.C. discussing my book, We Really Lost This War. And the strategy that I have evolved is to talk about the failures of the war. If I start out talking about legalizing drugs, which is the subtitle of the book, 25 reasons to legalize drugs, even though I'm a retired medical school professor, people turn me off immediately. I met with the NAACP, very interested, Hillary Shelton. I met with 3 black churches and talked to the clergyman. My opening question to them was, how many people do you bury due to the war on drugs compared to drugs? And after clarifying the difference which they hadn't made, they all concurred the burials are due to the war on drugs. And we have lost far more people in the war on drugs than due to drugs. Overwhelming. More people have been killed in the war on drugs than all of our wars combined, number one. The second point I make is prison is deadly. 1/3 of prisoners, according to the Department of Justice, are dead by age 45. Compare this to drugs of the night. I did not have one person, I was astounded, in 10 days of visiting organizations. Is anybody here from the NAACP? Anybody here from the National Organization of Women? Anybody here from Children's Defense Fund? We need to organize with them, and that's what I have been doing. And I could not believe the positive response I got. First talking about the devastation of the war on drugs and the devastation of prison. And by the way, AIDS also kills more people than drugs. And when you take this approach, and I think that's a strategy we need to think seriously about, and as a physician, that's what we think about all the time. What is the downside of chemotherapy compared to the upside? The downside of this war on drugs has been racism worse than slavery, and a murder rate in the drug war that far exceeds the overdose death. And by the way, we have 40 to 80 times the overdose death rate of the Netherlands, because they're not afraid to call 911 when their buddy overdoses. In this country, we wait so long for fear of being arrested that they die. So I've gotten an unbelievable response. I went to Senator Webb's conference Wednesday of this week, met some amazing people. Senator Webb is open to this, met with him personally afterwards. People already, the latest article was talked about this morning, shows that 76% of Americans now believe the war on drugs is a failure. About 86% Democrats and 66 Republicans. But that's a tidal change, and with 60 billion to 80 billion being spent, that's half a national health care plan. So I just wanted to let you know that, first of all, the war on drugs kills far more people than drugs. And when I've been on 6 radio talk shows in the last 2 weeks, and the big question from the wise guy radio talk shows is, well, Doc, I can understand marijuana, but you really want to give meth and heroin to these people? My question to them is, how many people do you want to kill in the war on drugs to prevent maybe one treatable addiction? And we're not even sure there'll be an increase in addiction. But how many do you want to kill in the war on drugs and kill in prison? And the discussion's over. Thank you very much.
I just want to say, in defense of my reputation as a clairvoyant teacher, one of the times when I predicted a tipping point was right after Proposition 215, and I was right. You just admitted that. And I'm here to say we are at a tipping point. We are!